Well, amazing there. You saw taste and texture. I hope you like that meal. And it's time for us to have this conversation we told you, which is very, very essential to our well-being as humans and the build up to us staying alive
And being well.
and being well, of course. Motel is still here with me, and we have a very, very important conversation we want to build around, and that talks about the silent health crisis. There's a whole lot that we don't pay attention to, but it's time we really pay attention to, because on the daily we see challenges, we see a lot of people getting to join the great beyond. That's the one I want to
Unexpectedly.
Unexpectedly.
Because some of them have some underlying health issues and they don't even know, and then all of a sudden slumber.
And it becomes a problem, and then you see loved ones crying out and feeling so sad. But I think it's high time we pay attention to all of that and have that sorted out. But let's quickly give you this guide. That it's good to have you just on this segment where we'll be looking at the chronic diseases as well. Mukhtar, on the lead on that.
Of course, chronic diseases we know are becoming increasingly serious public health concerns around the world, and of course here in Nigeria. We've seen conditions like hypertension, diabetes, heart attack, stroke, and kidney disease. They're all affecting our families and millions of people, of course, silently dealing with this. And most times you don't even see warning signs. Only complications arise over time.
Well, this is one of the cases we have because as many of these illnesses are linked to lifestyle factors, poor health seeking behavior, delayed diagnosis, and inadequate awareness. The good news is, however, is that the experts say many chronic diseases can be prevented or better managed through early detection. Earlier, we also have the healthier living and proper medical care being given to all of this put together as well.
And of course, joining us this morning to break down this conversation is Dr. ATTAH. She's a medical therapy expert with extensive experience in chronic disease management, medication optimization, and preventive healthcare. Dr. ATTAH, it's a pleasure to have you on the program.
Thank you for having me. It's a pleasure.
Okay, it's good. You look amazing. I like the combination. Thank you for joining us on the program. There's a whole lot. I like the fact that you said something behind on how you're able to manage your profession, how you're able to do the best of what you do with your expertise and all the knowledge gathered to see that we have lives saved put together. Let's look at basically on the basics and the health challenges and how that starts in Mukhtar.
And let's look at the bigger picture, because when we talk about this health crisis, we see a lot of people are even getting more affected and they don't even know of all these things. So why are we having an increasing concern about these chronic diseases that we've identified?
Okay, thank you, Mukhtar, for that, because that has also been a source of concern for us in practice. And it all boils down to lifestyle. Basically, because of urbanization, there is a gradual shift in the things we or our ancestors have been doing before. Gradually, we're neglecting. Now, take for instance, because of urbanization, you have long hours, you have to drive to work. That gives you stress. Then you also look at diet. Because you're rushing off to work, you do not have time to prepare healthy meals. What you have is you're picking your meals on the go. And because you're picking your meals on the go, most of those meals laden with sodium, laden with a lot of stuff that could also affect or impact on metabolic conditions. Then when you move from diet, then you will also see people don't get to move around now because of the ease of life. Now urbanization, technology has made a lot of things easy. People get to become sedentary. You don't find people moving around a lot as they used to. People have vehicles. Instead of moving around, you'll find somebody drives from one point to another. Instead of taking the staircase, the person prefers to take an elevator. And then instead of moving around, the person comes to the decks and then sits on the decks for almost 6, 7, 8 hours. So all these factors are part of the things that also affect and then impact on chronic diseases. Then, of course, we look at our environment. Because of massive urbanization, we're losing our green areas. There's a lot of industrialization and all of that. So those chemicals, all that interact with the environment and then our well-being, and then boils down to the chronic conditions.
I like the fact that you gave us that breakdown, because I was coming to the office this when I saw people jogging around. I'm like, I need to find a way in between all of this to find that balance, and do maybe a little of indoor yoga and all of that. So is out the stress and gets us that healthy lifestyle you mentioned. But let's look at the fact that what are the most common chronic diseases we mentioned in our introductory parts. We have most of these things currently affecting human lives, and it's easy to point out to Nigerians with some basics like the hypertension and all that. But from your perspective and working with people, what are these common chronic diseases that you see people pick up with a lifestyle that is deteriorating because you can't get to have a hands-on basic lifestyle that should give you that healthy life?
Okay, well, basically, we must understand what chronic means, because when you have a feel or a grasp of that, then you can see what and what can fall in between. Now, when you say something is chronic, it's not happening immediately. Yes, it's something that builds gradually. Yes, over time. So when you look at most of these conditions, stuff like hypertension, a condition like hypertension doesn't just happen, boom. It's something that builds gradually. Then you also look at diabetes. Diabetes is also a metabolic condition that doesn't just happen, except if it's genetics, because aside environmental factors and lifestyle, genetics could also play, but basically your genetics predispose you to what happens, but then your lifestyle amplifies it. So aside diabetes, you're looking at chronic kidney disease. A lot of people are coming that because that could also be a complication of hypertension. Aside genetic conditions, then you also look at heart failure, you're looking at stroke, just as he mentioned. Then it's a whole
all-encompassing.
Yes, and then of course when you want to come down, aside all this, you can also look at asthma, pulmonary lung functions, because people are going high on tobacco use, alcohol use, and also those interfere completely with the entire system. So you may find out somebody, because there is a genetic predisposition for something, then the lifestyle amplifies what is happening. Take for instance, somebody that vapes or takes cigarette. The person may be susceptible to pulmonary hypertension, lung disease, lung failure. Then of course there's also the burden of cancers rising. So all these are examples of the chronic condition.
Okay, before Mutara comes in, I know that I've lost loved ones to kidney failure, to diabetes, to hypertension. These are three basic things. And I looked at, let me start with the one on the kidney. I know he was quite healthy, quite chubby, God bless his soul. And at some point we started seeing where his feet started swelling. And I was worried. And I asked, I said, what's wrong with you? Because it was deteriorating. And then before we got to understand, when he went to run a series of tests, and we got to understand it was kidney failure. And we had to go through the phases of, what's it called again? Dialysis. And it was a struggle, a whole lot, because of course what dialysis is involved. And we couldn't, of course, get him back, because at some point he got out of hand. And then also they went to diabetes as well. Diabetes for long was actually well managed over time, and then there was an injury. They're not supposed to have injuries, and then the injury got to heal in between, and then because of when someone is in pain, all he's looking for is relief. And then of course there will be different ideas to what you can use to subtle and all that, and I think that also triggered so much. So I'm speaking from all these things for you to speak to us to understand where one is to know when to really draw the line, to pay attention to details in terms of the medication given, and not get carried away in the course of trying to find ease to the relief.
Okay, well, I'm sorry about your loss, and unfortunately this has always been the issue. Half the time when most of these cases get to clinic, it's already progressed beyond salvaging. Now, for your cousin or for your relative, if you look at it, hypertension, if he was hypertensive, that's a risk factor. If he was diabetic, that's a risk factor. So let me start with diabetes that you mentioned. Now, diabetes is when the blood sugar, it's not just a one-time reading, but once the blood sugar is persisted, elevated, and then it can't be controlled because one, our body is very beautiful and wonderful, thank God for his wonderful creation.
Yes.
But then when you look at it, when the sugar goes high and then it's not brought down or controlled, you find out that the sugar impacts on the vessel. Now, how does it impact on the vessel? It causes I don't want to bring in medical jargon, but of course there are a couple of linings in the blood vessels. You find out that it thickens those and then makes them stiff.
Okay.
So once they become stiff, the pressure, the blood doesn't flow as it should flow and then perfuse other areas. Now you have poor blood supply to the brain, poor blood supply because the heart has to work harder. Then of course the kidney, and that's why in diabetes management, it's beyond just taking care of the sugar. We are looking at how to protect all organs from further damage. So once it comes to that, it becomes very difficult and then it results in kidney failure. Now, most kidney failures that you are seeing is usually when the kidneys have over time received excessive damage, which could be as a result of high pressure. And then, of course, for some people, if he was young, because we're seeing that rising now in the younger demographics for people between 20, 25, 30, that's because substance abuse is on the high. So when you have excessive of all those illicit stuff in your system, the kidney needs to work twice its function, yes, as hard as it should, to get rid and then maintain. So at the end of the day, because it's overworked, then you have a collapse.
Okay, well, I think that helps Mukhtar
It
to
does
flow.
help. Now let's go back to the basic, because many people associate infectious diseases with these chronic diseases. They associate them with infectious diseases also. So why are non-communicable diseases receiving so much attention globally currently?
Okay, well, why it is so is because, let me use Nigeria because we're in Nigeria.
Of course.
Unfortunately, more focus or attention has been paid to infectious diseases. Now, let me take us or walk us back to what happened during COVID. A lot of us, when COVID came, boom, we need to save the population. It wiped out a lot of people as fast as it could. But you'll find out that when you have chronic condition, it builds. So it's there, it's looking at you, but if you're not paying attention to it, it keeps going slowly, and then boom, it goes. And when COVID came in, a lot of factors and things were put in place to slow or curb its spread. But then that is not happening, the awareness is not happening for chronic conditions. World over now, again, because of lifestyle, especially obesity, is on the rise. You look at children, school children no longer get to play outside. They are seated inside, always on a device or on computer games or with their books. So all those inactivity culminates. And before you know, the population demographics currently puts it that we have people more from 15 to at least 60 or 55, and if half of that population now is coming down with chronic conditions, then of course it calls for concern.
That's quite
It's a whole lot, and it's really a concern that we need to pay attention to, just like you mentioned, if we want to get past all of this. But would you say awareness among Nigerians is improving, or do you think many people still underestimate the challenges of this chronic illnesses? Because some people seem to downplay when they, for instance, just like you mentioned, when one vibes or takes the cigarette, sees as the happiness hormone, which makes him cool. I'm looking for that makes him feel relaxed and feel that it's enjoyment. Even though we see it's smokers are liable to die young, but people still want to live, and that also affects their health. Do you think there's enough awareness to help people understand the dangers?
Okay, well, a lot of awareness is currently going on, but I don't think, from what I see, and it's subjective, I don't think the awareness is sufficient. And then why that stalls is because a lot of Nigerians are afraid to be judged.
Okay.
Now, you find out somebody is having headaches, maybe he's struggling with a condition.
Yes.
He prefers to keep mute because he thinks it's a failure on his own part. And because of the silence culture that we have, you find out that people don't sought help as fast or as quickly as they should. Now, imagine a man, the head of the family, he needs to appear strong for his family, he needs to be there for his wife, be there for his children, and then in him, yes, he's dealing with his crisis, but he still needs to keep going because, exactly, if he breaks down now, the society judges him and says, okay, he's a weak man, and because of that, he quietly just says, okay, I will attend to this, I will attend to it, and then at the end of the day, it doesn't get the attention.
That's really a cause of concern, because I was speaking to people about this sense where we need to allow men have the vulnerability part and be able to cry. It's not a crime to cry because you're human, and there's always the mindset that you're a man. But when it comes to the health challenges, I think it's time we allow the men breathe, allow them to show their humanity as humans, and then be able to be tended to by giving them the proper. But let's look at measures and how to overcome all of this. Of
course, I know earlier you talked about lifestyle. I want, even though you already told us how the issues, so how can we have a better lifestyle that would see these chronic diseases stay away from us? Is there a particular routine or tips basically that we could use to see any change in the condition?
Okay, yeah, there are a lot of lifestyle modifications, because in chronic care management, there are some that are not modifiable, some factors are not modifiable, but then some are. Now, in the lifestyle adjustments, if you look at it, a lot of Nigerians are not hydrated as they should.
That's true.
Now, minimum consumption for water is at least 2.4 liters to 3 liters, but you don't find people taking that. Somebody wakes up in the morning because he's stressed from the previous night. The first thing he's taking is a cup of coffee because he needs to stay alert and then he needs to move. Then secondly, when you take out the issue of hydration, the next thing, which is the major factor, is diet. Now, imagine somebody wakes up in the morning, has bread and tea for breakfast. Then in the afternoon, the person has jollof rice, fried rice, or white rice and stew. Then in the evening, the person has eba. Thank you.
I just got
or pounded yam. Now,
Now,
if you look at the flow of the diet, it's just basically carbohydrates.
okay, so I would like to take that thought, but let's do that after this time out. We have this conversation still going around chronic illnesses, but we'll keep the conversation going as our guest still with us in the studio. Please.
With Global Morning, your daily guide to what's happening and making the rounds.
We delve into headlines, newspaper reviews, spot-on analysis, policies, current events, real talk, real issues that affect us all.
From the latest trends to the debates, every topic, every angle, Global Morning is where it all starts.
Global Morning,
For the latest issues,
always on point.
watch Global Morning Monday to Friday at 7 a.m., Saturday and Sunday at 8 a.m. on Global Television.
Well, we're still here, and of course, the conversation is still heating up, and we're getting to learn a whole lot of things that we need to understand about lifestyle. And of course, we still have our guest with us in the studio, in person, Dr. ATTAH, who is doing justice to this conversation. And she was speaking on some issue, and I told her to hold the thoughts. Where we talked about our lifestyle, what we eat, and how we manage all of that. And she talked about the swallow. I know that, that's I had to just mention.
But the funny thing is, most of us are actually guilty of this.
We're guilty of the habits. When we eat food, since our lifestyle has to,
a whole lot of carbs.
Carbs is our problem, and then we need to find a way of balancing that with the nutritious. We have a lot of nutritional value food that we can mix all that. I wanted to just.
But that brings also another point, Doctor. Before you make that point, because we've been advised to eat right, but another issue is eating right is not cheap. So where do we find the balance? It's honestly it's not.
So that is true.
So how do we find the balance between eating right and not breaking the bank, basically?
Basically, when you look at it, I think eating right, which is one of the major fears Nigerians have, but trust me, eating healthy and eating right is way cheaper. Now, if you look at it, 50% of your plate is supposed to be vegetables, then of course another 15 or 30% protein, then another 15 to 20% your carbohydrate. Now, if you look at it, we eat to reward the body, not actually eat to get nourished. Now, when people eat, let me just make this, and it's going to be funny, but let me make this. Over time, growing up, people tell you that, okay, they put a piece of meat on your food, then they tell you, finish the food first.
I think it was all African people that have that practice.
Finish your food first, and then have the protein.
Yeah.
And you look at the protein as the end goal, and that's why you see it gets people to eat, because there's this focus of I'm going to be rewarded.
True.
So when you know that your body is going to be rewarded with health benefits, the benefits could be longevity, and then of course strength, vigor, and all. You'll find out that it should be on your table. Now, eating healthy starts very easy. Now, how much is carrot compared to rice? Now, how much again are fruits, ugu, vegetables compared to pizza?
So let's talk about, okay. I wanted to say, let's talk about the price of fruits, for instance, watermelon. Aside buying, if you want to have it in the house for you to have on a daily, you have to get the ball of it. And how much is it now?
Well, let's say it ranges from 2,000 to 4,000.
So if you buy a ball, for instance, I want us to do the math. You buy the ball and then you have to eat that with the family. So that 2,000 goes for probably for dinner. And that's after the close of work and you're having to sit on that table. And then pizza could be whatever, let's say plus 14,000, 7,500, thereabouts. And that goes at the table for one time.
That's the mass ball.
I just want people to understand the picture of what she's painting.
If you look at it, basically, you can get ugu for 500 naira.
Yes, very true.
Steam it with a tablespoon of crayfish. You don't even need Maggi. Then just add a drop of oil. Most of our food in Nigeria, very greasy, very, very greasy. The ogbono needs to look red. The egusi has to have plenty oil. Then the efo the same thing. And then all these are dripping in oil that you don't need. Now, if you look at how much will it cost you to make oilless okra?
I just had that 2 days ago.
Exactly. So I think when people begin to get deliberate and intentional, and then disciplined, of course, you'll find out that it's easy. Go back to looking to our parents or forefathers, because they didn't have light or generator. What do? They make sure they have their meals at most before dawn, like 6 or at most 5 p.m. And then the next thing, they have tales by moonlight. Sit outside, tell stories to grandkids, relax the mind, then before they go to bed. But trust me, you and I, we get off work 6, 7, get home 8 p.m. And then we have our meal. The next thing, highest 30 minutes, we're on our phone. Then the next thing, we
go to bed.
Now, when you eat, it needs 2 hours
to
to digest.
Wow.
So these are conscious efforts that we need to instill. A lot of us, we need to rewire. And half the time, people think, just as she said, eating right is expensive. But trust me, it is
takes
not.
deliberate
It's
action.
cheaper to eat
It's
right
cheaper.
than to have a
Sure.
cost of medications eventually.
Sure.
I hope most of us will get to understand this and be very intentional, just like you mentioned, because if you're intentional, you get the end results of a healthy life, and then you live longer. And then that saves. But let's also look at the fact that, just like you mentioned, with the work itinerary and career paths, everyone's trying to excel in their career paths. Stress is a major concern. Stress becomes a thing that you cannot but deal with. For some people, they tell you stress makes me put on a lot of weight. Stress makes me lose weight. It depends on how your body system also acclimatizes with the stress pattern that you have. So how do we deal with that? How much impact does this have to with our lifestyle that also pushes us to that point? Because I know when someone is stressed, there's this headache that comes in most times in the middle part of the head here. I know I feel that sometimes. And they'll tell you need to sleep, and you need good hours of sleep. You need to take a lot of water, just like you mentioned about dehydration and how we have to be hydrated. So speak to us from your perspective. How do we deal with stress or manage it through growth and also being healthy at the same time?
Okay, for stress management, triggers are peculiar to individuals.
Sure.
So you have to identify what triggers you. When you are able to know your triggers, then of course it becomes very easy for you to manage. And one big factor where people are currently now, because of the way the climes are going, easily get stressed, just as you said, is sleep deprivation. Now, a lot of people, I think about 5 to 6 Nigerians out of 10 are sleep deprived, because you're supposed to have at least about a minimum of 7 hours of sleep.
Yes.
But half the time, most people don't
Your brain
get
is
them.
working.
At least we in Abuja get to enjoy that.
That's
Those
true.
in Lagos, I
They don't.
don't know how they cope.
How they
Traffic
cope
and all
with
of
it.
that.
Exactly. So when you sleep, is the body's form of healing and restoring. So it renews your cell, and then it renews the mind, renews the body. So when you skip that sleep, because sleep also comes in cycles. There are 2 cycles for sleep. When you miss one, or one cycle of the sleep is incomplete, you will find out that
It affects.
the other one, of course, it distorts the balance, and then it affects your...
I think I had the results of what you just said last night because I think I deprived myself the sleep of the previous, and then I had to manage through work, and I got home trying to get ready for the program and all that. I had a whole lot.
If you now you're back again, the cycle that
Back
you go
again.
to.
So cycles like this is what I'm looking at, and how people can manage through it.
Okay, and because of that, you'll find out that substance abuse is on the rise. Nicotine use is there, alcohol is there, and then of course herbal stimulants. I forgot to mention that that's also another thing dealing with the society.
Yeah.
So when you need to manage stress, first for some people they need to be in relaxed environments, take out time.
Okay.
Then of course exercise also is a form of stress management.
Okay.
Then of course sleep is also a form of stress management. And then social time also with family, which we also seem not to have, because for example, if you've got kids in the morning or when you are stressed,
There's no time to rest at all.
exactly, a 5-10 minutes dance or running around with your kids help to bring or douse the pressure
stress.
down, because those ones don't know or understand what is happening.
All they want is your time.
Let's just give us the
And then
time.
a lot of people look at music.
Exactly.
Music for me, I think music works for me as well. And some people do movies just like Mutar. He's acting like he doesn't understand something. Mutar does a lot of movies to relax his mind. And then like you said, it varies. And these are ways we can go past dealing with stress and also getting our health and lifestyle put in place. But let's look at, you've mentioned also substance abuse.
Of course,
Now-
because some people, the way they manage their stress is medication, and one issue health professionals like yourself frequently talk about is self-medication. So how common is this practice for people who are trying to, even not just stress, but overall the chronic illnesses? Some people tend to turn to self-medication. So what do you have to say about that, basically?
Okay, while self-medication is on the rise here, it's because paying out of pocket when you go to the hospital is very expensive. So somebody would, an individual would prefer to walk in, okay, please, I need this, and then take. And then again, we also have this culture of sharing of information amongst us. Mukhtar says he has a headache. Okay, he took this medication. Sorry, I don't want to mention products on air. And then he took this, and then he got better. And the next thing is, I feel, okay, Mukhtar did this, he got better, so
do the same.
Go ahead and then do the same.
And our system varies.
And, sure. And one thing for chronic condition, hypertension is hypertension, but then individual bodies are predisposed to different effects. So when you share medications with your relatives simply because this person is on this and it worked for this person, what you are doing is you are actually suppressing the progression of the condition, which what you do is you just hit the monster, and when the monster comes out, it
comes out in full force.
So I like the fact that you called it a monster, because I see, I think it happens mostly with the family space where someone is saying, I feel pain here, I feel pain on my back, and you probably use it.
The next thing you said, go and get this stuff and this stuff, because you work for me, like she said.
I think probably good orientation needs to go out for people to understand, because like I said in the first start in our conversation, is that people are looking for relief at the time, at the sight of pain, or some people don't even know how to hold on to pain a bit, where there's slight pain here and they want to just quickly take medication to suppress it, and then I see that you're shaking your head, so it's
sorry to cut you in. That's because half the time we are always reactive. It's only when the symptoms present or the signs present, then you want to address it. But chronic conditions, you can't manage it like acute conditions. So that's one thing people need to know. Once you have your numbers checked at least once in a year, you will find out that it's easy for you to catch it faster than when it's already coming in. So the body is programmed to give you signs or signals when something goes off. So the headache you're feeling may not just be high blood pressure, it could be sleep deprivation, it could be hunger, it could be so many things. But when you come to the hospital, it's now tailored and then narrowed down to say, okay, this is what happened and this is what you should do. So when we reduce addressing chronic conditions as acute conditions, yes, we'll find out that we'll get the quality of life that we need.
Now, another thing is, you see, in terms of medication, we get prescriptions, we start to use them, and then we feel better. And then some of us do not eventually conclude the dosage. We feel, I'm not having those headaches again, I'm okay, and then we stop. What is the dangers associated with such a
there are lots of dangers. Let me just use something as simple as antibiotics. Now, unfortunately, people think for every cough or cold symptom they have, it should be accompanied with antibiotic. Well, I'm using that because that's everyday thing that people do. You go to a pharmacy, somebody is treating malaria, the next thing is, I need to have an antibiotic because I have typhoid. Now, when you tell the person, do you really have typhoid? The person says, yes, I do.
And it's not sure without testing.
Insist without testing. Now, what you're silently doing, you're developing or building resistance in the community, such that very mild, let me use that word now, antibiotics that should have taken care of an infection, because over time you have abused it, you develop resistance, and then you look at it in practice now, people are becoming resistant because one, you go, you do a culture, and then the next thing, some antibiotics you're not supposed to use, they'll have to bring it in to use, and then the antimicrobial resistance is already setting in. And gradually, when that happens, it's something that we do not want on our plate. Now, when you also bring it down to chronic conditions like high blood pressure, somebody is on a particular medication, he gets better, you say, oh, okay, the high blood pressure is gone. I want to correct this misnomer about chronic conditions. Chronic conditions can't be healed.
They don't get cured.
It's just managed?
Yes, they can be managed. And that is why you'll find out somebody is hypertensive, goes off his medications, then 3 months, 6 months later, the person is back in the emergency unit.
Okay. That's really a serious attention to be paid to, because I see the fact that on a daily people don't adhere to things. They just feel it works like this. Some people also say, I use this, it works for me. And despite not testing, I'm always an advocate for you to test yourself. It's good when you have, just like you mentioned, the headache is just signs that there's something down there for you to check. And then some people are on medication, like the hypertension you talked about, they don't adhere to if some are on daily medication, some don't take it, and once they check once or twice and see that the blood level is normal, it's okay to just forget the medication for a while. And someday it just comes and it triggers because you've not checked, because you're supposed to monitor it and see the progression on how you did, and then stick to your medication. But some persons will tell you it's normal now, it has dropped. And for those that have it at a very low stage, I know a colleague who lost a sibling to hypertension as well. He said he was having a headache from, next thing, I think at some point he said slumped or something. And when they got in, it was really high, and he could not talk, he could not even feel himself, and somehow they had to lose him the cause of that. So I think people need to pay attention, just like you mentioned, pay attention to checking themselves. It doesn't cost anything to check yourself. Sometimes jokingly I tell people I'm a happy person, but it doesn't mean I don't check myself, because it takes lesser muscles to smile.
Of course.
And it's like you're looking pretty with it because you're always smiling. Then having a lot of muscles to squeeze your face and all that. And then I don't know if it's okay, but I'm thinking I also see that in my little way that you need to also be expressive. Find somebody you can trust and talk to. It takes a bit of, but I don't know if that works as well.
Yeah, that it does. That's well, it's a system that is gradually coming into our space in Nigeria here. Usually for the alcoholics, they usually have their alcoholic anonymous groupings where you feel free, you come, you express yourself and all. And then you also build your social capital. That's where I'm going to. You get people that you can confide in. And when you confide, again, whoever you are confiding must be somebody that should be able to lead you and guide you. One thing that also slows down people having access is fear. Then, of course, people spiritualize a lot of things in our climate here. Somebody will tell you that, okay, this is some sort of spiritual attack. And then doesn't get the needed thing done. I tell people is, even if the village people supposedly do exist, you must give them a leeway to operate. So if you shut that way out or cut it off, then of course it becomes difficult. So gradually groups are coming where people can feel free. Then of course you have family members that you can trust and confide in.
Another aspect is the facilities themselves and our hospitals and all of that. We have to come to that junction, because some of these chronic diseases, they are very difficult to manage. So how equipped are we to tackle this in terms of our facility and management of these diseases? Because people tend to go to hospitals and some of them lose their lives. Some people say it's the complicity or the lack of particular infrastructure. So how would you assess that particular aspect?
Okay, well, let me start from this way, because if you look at it, our centers are tiered. Now we have primary health centers that basically just address simple and minor issues. I'm trying to put it that way. Then aside the primary health centers, you also have the second tier hospitals where they take care of also some conditions. Then the last stage is the specialist hospital that also manage myriad conditions. Now, let me tell you something that happens because sometime last week I was discussing with somebody and I was referring the person to a hospital, and the person mentioned that God forbid I can be in that hospital because people lose their loved ones a lot there, and then people die and all. And one thing I said to the person, I said, okay, why it seems to happen that a lot of people are dying in that kind of particular setting is because they don't get there timely. They only get there when it's worse. And trust me, as healthcare providers, we are not magicians. We do our best we can with what we have. And then currently, if you look at it, most of our institutions are gradually, getting all the facilities, the equipment, the hands. Trust me, a Nigerian healthcare provider will rate one of the best in the world. So it's not as if there's a shortage of manpower or facilities, but the thing is, people don't get in when they should have.
Okay, well, we hope that people get to understand the importance of reporting early enough and then getting solution early enough as well, so that it gives them the opportunity to live the life they want to live, because that's where lives are cut short, and then people will still blame it on the health experts, just like you've just mentioned. But what are some of the major risk factors associated with hypertension? Because just like I mentioned, people are worried, and that becomes, just like you mentioned as well, cancer, hypertension is becoming a norm or normal thing today across the world, not just Nigeria, and people still refer it to what we eat, just like you also talked about healthy lifestyle of what we eat. Is that really the cause of worry, food alone, or is there just like genetics, just like the hormonal whatever? I don't know the grammatics because you're the medical expert there. But I'm looking at where we can go back to the days. It wasn't this pronounced back in the 90s, 80s, 70s. I just want to hear your point of view on that.
Okay, before I go to the risk factors, let me correct this. Back in the 90s, it existed.
Was it as much?
Yes. The thing was, there was no much awareness. Now, in the 90s, we don't have phones. Let me use that as an example. Okay. If you need to communicate to somebody in Lagos, you have to write. True. And then it has to go through the post office. It takes 5-7 days before it gets there. But now, because of technology, awareness, and a lot of things, the fact that you didn't see it 10 years ago
doesn't mean
exactly. The only thing now is because we have things that have enabled it to
stand well.
Exactly. Okay. Then when you look at the risk factors now, we have for hypertension especially, we have two categories of risk factors. We have the modifiable ones and then the non-modifiable. Now for the modifiable, unfortunately, you can't do anything about it. And then what tops that is age. As one of the non-modifiable risk factors.
So as one ages, he's more susceptible.
Exactly. Okay. At most from 40, the risk increases. But again, because of lifestyle, we're seeing it happening to people in their 20s and 30s. So still, age is there. Then, of course, you look at genetics. And usually that's why when you come to us in clinic, we have to go backwards in your history and ask, okay, is there a relative that has this? Is there a family member that has this? So when we get that information, then of course it helps, because yes, with the genetics now, we know somebody that has both parents hypertensive, 60 to 70% chances are that the person also, of course, if he doesn't control, will come down with hypertension. So when you move past age, then you also look at sex also. Men are more predisposed to hypertension than women. When you say that, people say, okay, because women are more vocal. So, and if you look at it, women are more in the hospitals every time than men. The woman is in the hospital for the children, she's in the hospital for her relatives, she's in the hospital for herself. But a man, you have to push and push and push.
Before he goes.
Yes, before he goes. And then, of course, the stress factor on the man. But then again, for women, the tables turn around. When the women age, they become more susceptible to hypertension because of hormonal issues than the men. So when you move from age, you look at also race. The African race is pretty susceptible to high blood pressure than the whites or the Asians. Of course, even the Asians are also at risk, but compared to Africans are top the chart. Then when you come to the non-modifiable factors now, then of course you look at lifestyle, tops it most, and underneath lifestyle, you're looking at sedentary lifestyle, you're looking at diet, then and all whatnot.
Okay, I wanted to clear that, but you actually cleared it off my mind, because when you said age, men being more prone to the hypertension, I was worried for the women, because I know when women get into advanced age and also during the childbearing, hypertension seems to be more for women. And I've seen a woman that have had to have children and some still get back to having hypertension as a concern in the course of childbirth. I don't know if it's the hormonal thing.
Yes, with pregnancies, you have myriad of hormones, so that predisposes women to having hypertension in pregnancy. But again, if you come for your regular antenatal checks, that's why we advise earlier on when you come to the clinic, because anytime you step into the clinic, one of the things they are checking is your blood pressure, and it takes just 1 to 2 minutes. So when the pregnant women come, of course, aside checking their vitals, there are other tests also that they run. Then they are actively monitored during the course of the pregnancy. So if the physician picks up any sign of the hypertension, then of course it will be addressed.
And when you look at chronic diseases and specifically the management, what strengths and do we currently have in our healthcare system that gives us the edge? Are there any particular strengths?
Say that again. Let me understand.
In terms of the management, do we have any particular area of strength that gives us the edge in terms of being proactive? Because most times you've said, and medical experts have said, the best is to nip it in the bud before it gets to the advanced stage. So do we have any sort of preventive or measures that can help us nip it in the bud before it gets out of hand?
Okay, basically when it comes to chronic disease management, I would say the responsibility is on the individual first before coming to the facility. And currently our systems are being upgraded, though it's not sufficient to cover the population, because one, we are already having a population burst, and then of course with the brain drain, all healthcare providers now are moving to look for greener pastures. So that also puts a lot of burden on the ones available, because you're supposed to attend to maybe a maximum 20 patients per day or 15, but then in a government setting, you're doing 50, you're doing 100. So yes, exactly. It's quite challenging.
Okay, so now I get to understand where doctors want to go for greener. Because I know as a professional across different fields, the brain work is actually very taxing, and you need to have good sleep if you want to flow better. Maybe I should start doing the medical thing as well. But I like the fact that you've also explained this, so people tend to understand your position as medical professionals and how you also are human, despite trying to save life and also give the best. But let's look at misconceptions before we try to wrap this conversation. There's a lot of misconceptions many Nigerians still have about a chronic disease, and then healthy living. And I know you talk about this, but in your own perspective, what is the one thing you want to correct today so our viewers can take home about the misconceptions around this chronic diseases and healthy lifestyle?
One thing I would say is don't stop your medication abruptly. Now, let me give this an analogy with a car.
Okay.
You buy a car, you don't drive it all year round, do you? if you cover some mileage or maybe on a monthly basis, you take it for maintenance and servicing.
Sure.
Now, the question is, if you are able to do that for your vehicle, why can't you do that
For yourself.
That's one. And then time is very, very key. And I usually tell people what you can nip in the bud is usually better, because there's this adage that says a stitch in time
Saves 9.
saves 9. Half the time, trust me, 9 patients that come in clinical setting have gone past the safe zone. And doctors, physicians, nurses, everybody working frantically just to put. Imagine when you come in earlier on, it gets that settled. So instead of rushing and then waiting out, just as you treat your vehicle, trust me, if you have a luxury car, you will take good care of it.
Of course.
Your body is your vehicle.
Luxury and vehicle.
And take good care of it as much as you can.
And that reminds me of one of our guests we had who was a cancer survivor. And when he was speaking, I saw someone who has gone through a lot and come and talk about it. And then he spoke about early detection. His own was detected quite early. And thank God for provisions as well. He was able to get it. And he's lived now 16 years.
Post-cancer.
Post-cancer.
And I have one more question, doctor.
Okay.
For people who feel full of life, very healthy, they've never felt a headache, they've never had any reason to go to the hospital, would you still advise them to go for checks periodically?
Yes, I will. Now, usually gold or standard procedure, once you get to 40, trust me, I don't know why this car analogy keeps coming to my head.
It's good to speak about.
If you buy a car, let's say in 2020, and then we're in 2026, you still have the car in 2026. Trust me, if you don't get the car checked, someday the engine will pack up. It's the same thing. The fact that you're well, I've seen a lot of people, they come, look well, and then the next thing they're dropping like flies. Now, what is wellness? Wellness, for some people, will just be, okay, I don't feel anything in my body. Chronic conditions don't tell you, or you don't feel it. You can't feel chronic conditions, but they are there. Imagine if you pushed pressure in a hose. Now, of course, you'll find out that the hose will expand to accommodate those pressures. Same thing is what is happening on the inside, and that's why we require that you come in. When you come in, the laboratory people, they do their own, they are the ones that give the data. Then of course we look at it, and then from there build on your care. But when you don't show up and you feel fine, which was what happened, I think last month we had the World Hypertension Day awareness, and we were handing flyers over to people, and somebody said, I'm fine, I don't want to check, because when I check for something, it will be there. So what I don't
So ignorance is bliss for him.
exactly doesn't hurt me, and that's the point that I'm going. A lot of people are moving ignorantly, and then they get to a point where they just stop. So please, I urge us, let's don't allow these chronic conditions stop us. Let's stop it and then put it in check and then get our life moving.
Okay, I like that as a closer.
It's a very,
It just
very
says-
resounding closure.
Yes, it gives out the message for he that has ears, let him hear. And because we have eyes as well, you're watching, you're seeing. Take it as one of the major advice you can get from Dr. Saadat to ATTAH, who has been amazing and breaking this down. I like the fact that she was able to say, I don't want to use the medical, so I don't confuse people.
He was very layman-like, even the common man will understand.
You understand how. Thank you so much, Dr. Saadat, for your time.
It's been wonderful.
It's a pleasure.
Our pleasure having you, and we look forward to seeing having more engagements with you, so people get aware and stay alive. That's our focus. Thank you so much for your time. Amazing conversations here around how we can stay and manage chronic illnesses and get safe out there.
And of course, the message is clear, which is the fact that many chronic diseases can be prevented if you detect them early and manage them effectively, especially when individuals take proactive steps towards regular healthy living and healthier checks?
Well, you've seen that building a healthier society requires awareness, personal responsibility, access to quality health care, and a stronger culture of prevention. And we've told you all of this, so we look forward to seeing healthy people living in Nigeria, because like I said, always Nigeria is blessed, and we're blessed people. It takes knowledge to stay alive and be the best you can be around yourself. It's a global morning, and of course a lot of discussion lined up for you today. We just concluded this conversation, and up next is our next discussion. Don't go anywhere, stay with us.